As government plans to disburse money to vulnerable Ugandans during lockdown through the mobile money system, opposition members of parliament want this exercise to be deliberated upon by parliament to avoid misappropriation of funds like it was during food distribution during the 2020 lockdown.
But instead the food will not reach the people. How are we convinced that the money being distributed through air on mobile money shall reach people that are not even identified and physical?
It can be a lot more precarious because if people in government can steal food, posho and beans, how about money now? Cash. So we want a proper layout of how this is going to happen. Is the Prime Minister's office, for example, going to involve the local leaders, the MPs, the mayors, councillors, because these people, they know their areas a lot better than Prime Minister and her team sitting in their office and determining, let's draw up a list and see who needs food, who needs support and that kind of thing.
Leader of the opposition in Parliament, Matthias Mpuga, said government did not put stringent measures in place after the first lockdown to curtail the spread of COVID-19.
Ideally, the initial lockdown should have been a stopgap measure to help the country buy time to develop a robust response system and mobilize the resources.
The legislators also want the Ministry of Finance to scrap the new taxes on fuel and other commodities for now. The MPs have appealed to President Yoweri Museveni to assent to an NSSF amendment that in part enables savers access to their money during the pandemic.
We believe the safety of citizens that subscribe to this fund would rely on assenting to this law to enable access, because the pronouncement by the managers was that somebody in a terrible condition. So what do you do with your money when you're in a terrible condition?
Meanwhile, members of parliament of the NRM have petitioned the Prime Minister to prevail over hospitals on the exorbitant charges for COVID-19 treatment.
Government should immediately interrogate overcharging of COVID-19 patients and regulate these prices in the private sector and offer standard reference prices for treatment of COVID-19 patients.
This is very unpatriotic and very inhumane of them. You can't imagine that somebody is kept in the hospital at the ICU unit and is being asked to pay over 10 million per day. What kind of medicine are we buying?
They say the private hospitals are not sympathetic enough in the time of great need.
They even identify for you some pharmacies where you have to go and buy drugs. The drugs are very expensive. There is no drug that is less than 700,000.
We had the health minister mentioning that she's concerned and she was condemning the action, but that is not enough. I think there should be an intervention.
Aaron Mukama, NTV.